Hi, welcome to this unique haircare initiative by IPCA. I'm Mona Sharma. It's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a problem of middle age when we used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and can be avoided with timely interventions. Today, we have with us Dr. Barua is a well-known dermatologist and has been practicing medicine for over many years now. He's MBBS, MD, and specializes in dermatology, cosmetology, and trichology. Currently, he's practicing as professor and head department of dermatology, Assam Medical College and Hospital, Dibrugarh. Doctor has dedicated his career to diagnosing and treating a wide range of skin and hair conditions by providing personalized haircare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you so much, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live
Thank
show.
you. Thank you, Dr. Mona, and it's a pleasure to be on this platform with you and with the audience, of course.
So, Doctor, today we are going to talk about hair care in current scenario. And whenever we talk about hair care in current scenario, the very common problem which is faced by all of us, irrespective of gender and age, is the hair loss. So, can you please enlighten us with your profound experience, like what's normal and when to be concerned for?
Okay. When we mean hair loss, we are actually seeing that, normal hair cycle, there is a growth and there is also shedding. So that is
Mm-hmm.
physiological. So when the, hair shedding is
Mm-hmm.
in excess of the hair regeneration or the hair growth, then only it becomes an issue of where we use the term hair loss or alopecia. So, because a lot of times people have the misconception that losing about few strands of hair is a disease process, which it is not, because it is physiological hair fall. So, up till about 50 to 100 follicles are shed off normally in an individual. So, that's not a disease. But yes, when there is failure to regrow the hair after this normal shedding process, or the shedding process itself is much in excess of the physiological sort of threshold, then that is where we call it alopecia or hair loss. So there are, of course, there are various causes of it. Probably we'll
Okay.
take it up, Gola.
Yeah.
Yes.
So our next question is this only, doctor. Like now that we know that what's normal and meant to be concerned for, another very common question, like people who are prone to hair fall, they keep saying, "मेरे को ही क्यों हो रहा है? मुझे ही क्यों हो रहा है?"
Okay.
So what are the general causes of hair loss? Yeah.
Yes. तो मुझे क्यों हो रहा है? Actually, वो that segment probably something to do with genetics. So genetics is one cause where we know is patterned alopecia. The hair loss happens in certain clinical patterns, whether it's a male pattern alopecia or a female pattern alopecia, which is known as androgenetic alopecia. So it's some component of genetics and some component of andro, that is hormonals. So yes, genetics, then hormones do play a part. Then, of course, you would have other risk factors like sometimes drugs. So, drugs in the sense the therapeutic agents that we use, say cancer therapy, or say other psychotropic drugs, can cause induced hair fall. Of course, they should be short term while the drug's action is in the body. Then there would be, physiological sort of alopecia, the physiological imbalance in hormones that would be very common with pregnancy. So there is a sort of increased shedding of hair during the pregnancy and especially post delivery. So up till about 6 months after delivery. So that is accentuation of the normal physiological process. So that's another reason. So itself, and then there would be other infective causes like fungal infections can involve the scalp and cause hair loss. So that is an infective condition. You could have other autoimmune conditions, say conditions like SLE, where you have shedding of the hair. There are other causes where you will have various, sort of causes of scarring as well as non-scarring alopecia. So it's a broad entity, but if you want to summarize it a bit, yes, genetics, your genes do matter. तो मुझे ही क्यों हो रहा है, तो that you'll have to blame your genes, and
Okay.
the rest of course are modifiable, whether it is infection, whether it is hormones, whether it is drugs, or sometimes of course due to poor hygiene itself.
Okay, quite interesting, doctor. So, doctor, we said about you said about stress, and you also mentioned about the diet
Yeah,
part also.
that's
So,
another
yeah,
area. uh,
yeah,
I
yeah.
I have to highlight this because stress in today's world is one of the chief causes of not only inducing alopecia but in perpetrating or in uh, basically in progression of the alopecia. Stress plays a major role because it's a vicious cycle. Hair loss causes stress, then stress itself will cause more hair loss. More hair loss causes more stress. So that's the vicious cycle which we need to identify in a subset of patients. And there is again the role of certain specific manic habits, like one condition called trichotillomania, which is very common in adolescent girls, with which where they actually pluck out their own hair. That is actually a release of stress that happens without their uh, volition. I mean, most of the times they do not have, uh, they are not aware that they're doing that. So that's another condition. So stress definitely plays a major role, and we know, need to identify this when the patient is on therapy itself and when the patient comes to us.
Okay, quite interesting, doctor. So, doctor, like आजकल हम सबकी lifestyle बिल्कुल ही like it's like complicated, and we work like late night, and whatever we get, we eat that. We ready to eat meals like, or either we order from outside and just eat it, and then. But so,
Right.
can a person's lifestyle play a role in hair loss?
Yes, most definitely. As I said, sort of indisciplined lifestyle where you do not have proper meal times, and it's also important to not only to eat proper food but also at proper times, and then have the balanced diet. So, because a lot of the micronutrients that help in growth of hair comes from the green vegetables, come from our fruits, come from our other sort of sources which are commonly not seen in your fast food that people have got addicted to, sort of. So we need to have more greens in our diet. We need to have more fruits, more antioxidants, so that all these provide the micronutrients for good hair and as well as for hair regrowth. So yes,
Okay.
lifestyle with fast food, less of sleep, more of stress, all adds up and amplifies sort of the negative sort of environment for growth of hair.
Okay, so lifestyle is a very important, and healthy lifestyle is very important, so that we keep our hair health very good. So, doctor, like now that we know the all these factors which lead to hair loss, another very common problem is that कि इतना information है everywhere. Like while we traveling, we see a poster. Social media खोला इतना सारा ये treatment है वो treatment है. 99 में तो आपका पूरा बाल आ जाएगा. Come to us. So, doctor, like what are the actual medical treatment available for hair loss? Like surgical, non-surgical, or is there oral or topical also which we can take and manage our hair loss?
Like every other condition, hair loss definitely has standard guidelines for its management. There are, as you have mentioned, there are medical therapy available, there are procedural therapy available, and there is, of course, you can go for surgical therapy. And since you have addressed this, there are also a host of, you know, uh, uh, non-evidence-based sort of therapies that are bandied about in social media, which may not have all the substantivity that other tested therapies do have. So, that's an open thing for our viewers, that please discriminate between what is evidence based over a long course of history, medical science, what has worked in a greater number of patients, against some anecdotal evidence which is bandied about with a lot of therapies that we see. And secondly, if you come to the specific therapies, yes, depends on the condition, as I have said. So you have the topical therapies, uh, uh, lotion-based preparations, we have foam-based preparations, then we have oral medicines available, and then we have procedural treatment to augment the outcome that we see with either topical or combined with oral. And then, of course, as a last resort, or in certain subset of patients, especially when there is destruction of the hair follicle itself. In certain conditions, there is no hair follicle for the hair to grow out. Scarring alopecias, the hair follicles are destroyed. So whatever medical therapy you would use, those hair, there would be no hair regrowth. There are no follicles. So those are the subset of patients who will need a surgical treatment. They will need transplantation of the hair. They will need fresh hair follicles on the scalp for the hair to grow.
Okay, quite interesting, doctor. So, like, lot of medical treatments are available, and people don't need to worry or feel lack of confidence कि क्या करेंगे बाद में है. So, doctor, does the treatment, like for example, treatment लेने से पहले cause भी पता रहना जरूरी है? Like people should know, like ये treatment तुमको तभी सूट करेगा क्योंकि ये तुम्हारी इस cause से है.
Exactly. There is no one fit. One fits all sort of therapy in alopecia. So it will be customized as per the etiology or the causes of the alopecia itself, and then the patient factors itself. What are the other comorbidities that the patient have? Is the patient diabetic? Does the patient have thyroid, hyperthyroidism or hypothyroidism, which can be contributing factors? And there could be other comorbidities. So these have to be taken into consideration as a whole. The age of the patient, the sex of the patient, the associated comorbidities, the extent of the disease, the severity of the disease, and then the causative factors, the etiology. So is it an infective cause? Suppose if it's in a school children, the most common cause of hair loss in school children is due to fungus. It's called tinea capitis. So it's caused by a group of fungus called dermatophytes. So there it will be antifungal therapy. Proper antifungal therapy will get rid of the fungus, and thereby there will be the regrowth of the hair. So that way we have to approach. Then there are certain non-infective conditions, or as I had mentioned at the start, there are certain patterned alopecias where hormones play a part, androgenetic alopecia. There you will need to reverse the hormonal imbalance. There you would probably need even oral therapy for a sustained. And then there are subset where you will go for procedural therapy, not only straight away hair transplantation. There are procedures like PRP, platelet-rich plasma. There are procedures like even with laser therapy for hair regrowth.
Okay, so blindly just going by yourself and getting the treatment is of no solution. You should go to the doctor.
ये मेरा भी हुआ था, मुझको इससे फर्क हुआ था, आप भी यूज करो. This doesn't work.
Yeah. Okay, very interesting, doctor. So like connected to this only कि मैंने ये use किया था, मुझे फर्क पड़ा, तुम ये use करो. So there is one word called nutraceutical which is getting a lot of focus nowadays on Instagram and everywhere, social media. So
Sorry?
what is this nutraceutical? Yeah.
I didn't get it. Can you repeat that?
Yeah, so like word of a mouth, like for example, मैंने use किया कुछ supplement and मेरे बाल आ गए, so I just tell to my friend that you can also try, but that is not the right option. But yeah, so there is one word called nutraceutical which is getting a lot of focus,
Nutraceuticals.
and
Okay.
yeah,
Yes.
yeah,
Yes. Yes.
yeah.
Yeah.
So
Nutraceuticals definitely play a part as adjuvants. So in
uh-huh,
a setting where there is hair loss due to deficiency or hair loss due to a sort of a transient hormonal change, in those phases, nutraceuticals have the best effect. But if
okay.
the hair loss is due to something underlying disease condition, underlying hormonal sort of derangement, or underlying autoimmunity, then just a nutraceutical wouldn't help anyway. So it is. So you need to know it. Say a nutraceutical works for say condition like telogen effluvium, which is very common. Say there is increased shedding of hair following the pregnancy. So there it will recover with nutraceutical because at certain point of time that hormonal imbalance is going to redress itself. Okay, but if you are talking about say an autoimmune condition, say an SLE where there is only nutraceuticals wouldn't help, or there are other conditions like alopecia areata, so where we need to give specific topical and or systemic therapy, and sometimes it might also involve using injections on the area of hair loss.
Okay. Okay. Quite interesting, doctor. So, doctor, like there are so many herbal plant extract, phytoconstituent. Do they really promote hair growth?
Uh, I mean, I cannot give a generalized yes or a no because yes, some plant extracts have been incorporated into evidence-based sort of hair preparations which have shown action. But whether the same plant extracts would have the same treatment outcome as a monotherapy, that is to
Okay.
be still known. So when it is used as an adjuvant with some other active ingredient, it does seem to work, but whether it will work on its own, so there, the still the final outcome is yet to be out. We are still having studies going on, but yes, nutraceuticals, plant extracts, more research needs to happen to generate enough evidence to conclusively say that this works and this doesn't work.
Okay. Okay. Very informative, doctor. So, doctor, like after like hair loss, there is another very common problem is the dandruff. So, do people have should take dandruff very seriously, or and then does dandruff cause hair fall, and can we manage dandruff by using just anti dandruff shampoos?
Yes, dandruff is sort of a attendant sort of problem with the peripubertal years when the oil glands start to produce more sebum, and then there is a oily scalp, and then that's the offers the best nourishment for the growth of the organisms that cause dandruff. It's basically these are normal skin flora. They are present in our skin normally. They do not cause disease, but when they their environment, a proper environment is created for their growth. For example, in case of the organism causing dandruff, it's a lipophilic environment or an environment rich in oil. Now, where is the oil coming from? It's coming from the sebaceous glands, the oil glands. Now, why is the oil increasing? Because there is more production of oil from the oil glands in the peripubertal area because of hormonal influence. So that is when people start to get dandruff. Okay, so that has to be managed because number one, it causes a definite sort of social embarrassment if you have dandruff all over your, your sort of dress, and it can also lead to hair fall. Yes, true. So not only hair fall, it can also be a contributing factor to acne itself or pimples, which we
Okay.
call balance. So dandruff needs to be managed, and there are sometimes dandruff itself can be associated with a condition with an inflammatory condition known as seborrheic dermatitis, which again is another disease condition where you will have a lot of flaky sort of flakes on the scalp
Mhm.
and other areas of the body. Okay, so dandruff, of course, needs to be controlled. We have a lot of formulations of shampoos available,
Yeah.
and you need to take care of as I had mentioned, the dandruff grows in that oily environment, so you need to take care of that oily environment to redress the issue.
Okay, doctor. So, like, doctor, we are talking about anti-dandruff shampoo. So, there are many OTC and medicated shampoos which contains like ketoconazole plus combination of ZPTO and moisturizer. They are like frequently used for managing dandruff. So, what's your opinion on it?
See, the organism for dandruff, the Pityrosporum ovale, that is responsive to antifungals. So,
Okay.
ketoconazole or any other azole for that matter
Mhm.
is an important part of therapy
Mhm.
uh, in the form of shampoo formulations for the scalp.
Mhm.
Now, yes, you might be probably referring to the recent the regulatory clamp on
Mhm. Yeah.
the combination therapies, right? So one of those
Yes.
several combinations would be ketoconazole with a moisturizer,
Mhm.
ketoconazole with sort of like you had mentioned, jet PTO. Yes, these are
Yeah.
no longer sort of acceptable combinations, but
Mhm.
for therapy purpose, we generally use ketoconazole as a monotherapy itself. Depending on the nature of the hair, yes,
Mhm.
we can give a conditioner that may not be in the same formulation.
Mhm.
So, as a whole, there are several irrational sort of combinations present in the
Mhm.
market,
Mhm.
uh, um, uh, which might cause problems in the long run. So, yes, you need to choose your formulations, and for that, of course, you need
You
to
have
visit
to
the
the doctor.
dermatologist. Yes,
Yes, yes. So yeah, so instead of using it by yourself, if not going away, you should visit to the doctor, and because dandruff can is not only letting your hair fall, but also
yes,
going acne and other more
yes,
problems.
yes.
Yeah. So, doctor, we were talking about stress, and stress, like you said, that stress is a vicious cycle and lead to many problems. So, when we are stressed at home, एक घर का नुस्खा जो हर मदर देती है कि ऑयल लगा लो, ऑयल का
Hmm.
मसाज कर लो, and then they also say कि भर के ऑयल लगा and sleep, and then next morning if you wake up, you have a longer and stronger hair. So, what do you think? Oiling hair is a boon or a ban? What's the fact behind this?
How I wish it was true. I mean,
Mhm.
the research that oil, helps to grow hair. Then I am sure I would have had more hair on my head.
Mhm.
So
Mhm.
that's a big myth. There is no oil in the earth which can grow hair. Okay,
Mhm.
it's basically, yes, you need the oil. You see what happens for the baby. We go for massaging the baby. Why do we do that?
Mhm.
Because in babies, they do not have active oil glands. Their
Okay.
sebaceous glands are inactive. Okay, they are
Mhm.
not mature enough to produce oil.
Mhm.
Therefore, we give them massages. Okay, but
Mhm.
we attain the age of puberty, our
Mhm.
our oil glands, our sebaceous glands get active, get mature. They start producing oil on their own. So
Mhm.
once they do that, in individuals who have oily scalp, there is no
Mhm.
point in daily using external oil application. That will only contribute to more of the oil in the scalp. So there you need to find the right balance between
Mhm.
between a, a, a dry and irritated scalp and an oily scalp. Just
Scary.
the right balance. So yes, oiling is necessary even in an oily scalp, but the frequency
Mhm.
has to be. I mean, it cannot be daily basis. It cannot be like what it was when you were a baby or when you were a child. So
Mhm.
similarly, for hair regrowth, you know,
Mhm.
you are using various serums, various lotions. Now,
Yeah.
for them to work, for
Mhm.
all of them to work, you will
Mhm.
need a scalp that ensures these serums and the oils penetrate through the scalp into the hair follicle. Now, if
Mhm.
you are using oil regularly, that oil
Mhm.
itself will actually coat the scalp, will form a layer which will
Mhm.
prevent the serums and lotions from working best. So
Mhm.
that again becomes an issue. So there again, So oiling, yes, at regular intervals as per your requirement, whether you have a dry scalp or an oily scalp.
Yeah,
But
yes, correct. Okay.
would I suggest it as a routine mandatory thing? And there is no oil, let me again reassert, there is no
Mhm.
oil in the world which can grow hair.
Okay. Okay, so don't spend your money, important money, to such oils which promise you to give you hair. It's better to go to the doctor and get the treatment. Quite interesting, doctor. So now my favorite part, doctor, can you give us some important tips for healthy hair today?
That is, of course, this has to be a holistic thing. It cannot be so, okay, do this, do these 5 things, you will have good hair. It will be, of course, customizable for each one of us. But as a whole, holistic approach should be to maintain a very balanced lifestyle and eat proper balanced food, avoiding as much of junk nutrients, a lot of antioxidants in your diet, have very copious amounts of water and fluids, hydrate, keep your body hydrated, and then of course the regular hygiene of the hair and the scalp per se. So yes, where the oiling of the hair, yes, once in a while is important, but more important that is to keep it, you know, less greasy, or control that greasiness and the stickiness. And of course, for ladies with long hair, they need to maintain that, and then they have to have a balance between hair styling and, I always find this association that people go to a parlor, do a hair straightening, and then 6 months later end up in our clinics complaining of hair fall. So some people are probably overdoing those hair styling bits at the cost of their hair growth. So we need to strike the right balance for that, and then of course, once you identify that you have some sort of a hair problem, you need to consult uh, a specialist in this regard and take therapy. And probably these are some of the tips that, what you had asked for.
Wow, doctor, thank you so much for giving us such a wonderful tips, and I hope I'll do all of those things. So, doctor, this discussion was very informative. I'm sure our viewers have found the session very helpful. So, can I take some live audience question?
Yes, sure. That'll be
Yeah.
great.
Doctor, the first question from our audience is, hi, doctor. I have endogenic alopecia and I'm also from Dibrugarh. आप medical college में देखते हैं क्या? I need your appointment and मेरे को
Uh,
C grade है और मेरे को डॉक्टर ने बोला अब कुछ नहीं हो सकता.
yeah, you would find me in the medical college. I also have I also consult. We have a clinic at Sun Polyclinic. So that's fine. You, wherever it suits you, you can consult me, and only after I see you can I comment on the exact nature and the extent of therapy of your disease, and then we'll have to match the treatment as per the disease severity. But don't lose hope, because alopecia, in whatever grade it is treatable at the present of time.
Okay. So you can Google the doctor's name with the medical college and just connect with him and can take the appointment anytime. Okay, another question from our viewer is, Doctor, my age is 19 years and मेरे hair fall हो रहा है. Why at such a young age I'm having hair fall?
I wish hair,
Condition है.
hair fall believed in, a particular age. It can happen to anyone. So yeah, don't say that it is happening so soon. It can happen. So first, at this age, the common thing that we find is one of the two. Either there is a deficiency in the iron stores. So that is very commonly in this age group, because of the menarche happening, then the menstrual periods, which obviously leads to more of blood loss, and down regulates the iron stores. So that could be one factor. Plus, that the youngsters are more probably prone to having sort of junk food, not having enough greens in their diet. So that could lead to depletion of the micronutrients. So that is one cause. The second cause, again very common in this age group, would be underlying disorder or autoimmune disorder, sort of, which most commonly could be a thyroidal problem. Okay, so one of these two issues, it's a very simple test can be done to find out which of the is actually plaguing the patient, and accordingly we customize the therapy. Whoever you are, please do not stay away from consulting someone nearest you. Whoever is there, please consult. You will definitely recover all your hair.
Okay, quite interesting, doctor. Hi, doctor. I'm at my menopausal age. My age is 51, and I'm facing a severe hair fall. And someone told me that hormone therapy can help me. And also, I wanted to know that do you do online consultancy?
No, I don't. For the last question, no, I don't. I'm not very comfortable with seeing images and diagnosing. Doesn't give me as much confidence as I have with a physical consult, where I can see the lesion, where I can palpate the lesion and do other close examination, which helps me to make a more sort of more confident diagnosis. And so I do not do online. But yes, regarding your earlier question, yes, perimenopausal hair fall is an issue. Again, this is due to the hormonal imbalance. So during, as you approach your menopause years, there is again a hormonal sort of surge happening, which contributes to more of hair fall. But then again, the surge will be for a period of, I mean, for a certain specific period, after which again it normalizes. So if during that period there is excessive fall, then there is of course, you can take recourse to hormone replacement therapy only with some consultation with your gynecologist, as well as a endocrinologist. So those two consultations are mandatory, and sometimes even a dermatologist. We have a sort of a what you call uh, it's a multi-disciplinary consult,
Multidiscipline, yeah,
right?
yeah,
So that
yeah.
we arrive at the best sort of treatment modality for the
Mm.
patient. Hormone replacement might work in one patient, might not work.
Work and
But that
another.
needs to be ascertained with that joint consultation before a patient goes for that.
Okay, doctor. So I'll just quickly take last question from our audience, which because we are running out of time.
Yeah, yeah, sure.
Yeah. So the question is, Doctor, 2 years ago I faced a fire accident, and due to that I got a scar on the side of my head, and I applied every home remedy, oil, everything, but the hair is not coming back. What should I do? Should I take an appointment of hair transplant?
Yes, so that is one area as per your history. What tells me, unfortunately, probably your hair follicles have been destroyed by the thermal injury that you suffered. So only a physical consult will help us tell you what is the condition of your scalp hair follicles, whether all the follicles are destroyed or whether there are certain follicles that are still intact. If so, then there will be hair regrowth from those follicles. But if the majority of the follicles are destroyed, then the only option for you is to go for a transplantation, where fresh follicles from your other part of the scalp would be then transplanted into that part, and you will then have hair growth from those transplanted follicles.
Okay, very interesting. So these kind of patient also do have a treatment instead, feeling lack of confidence or something like that. So I just want to ask one more question, doctor, because even I'm interested to know whether the gut health can cause endogenic alopecia.
Sorry,
The
the
gut health, like if your health is not good enough, so can that cause endogenic alopecia?
androgenic alopecia and
Is there any relationship between endogenic alopecia and gut health?
gut health. Okay, okay. I didn't get you. Yes, yes. Therefore, the use of probiotics and other stuff, those can help. Yes. Some are still gray areas as to the exact mechanism how they work, but Then again, having a good digestive system helps in sort of obviating certain risk factors for developing AGA or androgenetic alopecia. Yes,
Very
that's
interesting, doctor.
a very nice
Yeah.
question. I think we need to have more evidence before I can actually point out what would be the specific mechanism. But then, yes, there are some anecdotal evidence coming in. So probably research is happening, and it will probably in another 5 years, 10 years time, we will have a sort of a specific
Yeah.
association. Yes.
Yeah, maybe because of bad gut health, there is some kind of stress in our body, and because of that stress, we get the hair fall. So anything can be possible. Anyways, doctor, finally, would you like to give any take-home message or any other suggestion to our viewers today?
Uh, I feel yes. Hair is supposed to be the crowning glory. So we need to do our best to maintain it as well as possible. Of course, with considerations of age, yes. But as a whole, the holistics, this thing of good hair, to achieve good hair is probably to have a very balanced lifestyle with a very balanced sort of diet with a lot of greens, a lot of micronutrients, a lot of antioxidants, and to take proper care of the hygiene, the hair scalp hygiene, and to keep our scalp dandruff free and other sort of common infections that can cause hair loss. And then once we have identified that there is something lost, something that is not good with the hair, there is some fall, there is some loss, then we need to consult a trichologist, a dermatologist with a specialization dermatologists are actually the true trichologists where we deal with skin, the hair problems. So and then taking in, I mean, not falling into the trap of using something just for the sake that someone in social media or in the
Yeah.
community have used it, found good results. Because every treatment needs to be customized as per your disease, as per your body, as per your age, as per your comorbidity. Remember that.
Thank you so much, doctor. Thank you so much for sharing all your expertise and all the information with us today. I'm sure the viewers have found the session very helpful, and it was really delight to have you, doctor. And thank you so much for your valuable time. I really enjoyed talking to you. I don't want to let you go. I want to talk more, and even the viewers wants to talk more.
Credit,
They are asking many
credit,
questions.
credit goes as much to you for being such a seamless sort of host. You have wafted through the various spheres of hair loss and probably given insights to our viewers and listeners. So thanks to you as well, and it was a
Thank
pleasure to
you.
be on this
Yeah.
platform. Thank you once again.
Thank you, ladies and gentlemen, for joining us today. And yes, we'll take our doctor's appointment one more time with a new topic on hair care, and we'll discuss more whenever doctor have time, and we'll connect again. Thank
Look
you
forward.
so much, doctor. Let's sign off for today and see you soon.
Bye. Good night.
Bye bye.
Good night.
Good night. Take care.